Flow diversion is really a tremendous evolution for the treatment of intracranial aneurysm because it has a very high efficacy in terms of aneurysm occlusion and a very good efficacy. One big limitation of this treatment as of now is that we need to place the patient under dual antiplatelet therapy. On doing that, we cannot use this device in the treatment of ruptured aneurysm. So having surface modified flow diverters will permit us to treat patients maybe under single antiplatelet medication and to use the device for ruptured aneurysm. HPC is a very innovative coating, surface modification, which can be used for every kind of design, but here we are discussing flow diverter. And the idea is to mimic what we have naturally in the brain arteries, which is glycocalyx. Glycocalyx is existing in the normal vessel, and it's avoiding platelet aggregation in the normal vessel. So HPC is a glycocalyx-like surface modification that will reduce platelet accumulation inside the device that is placed in the arteries. We start treating patients with P48 HPC flow diverter recently in May 2019. We treat several patients with the device. It was working very well. We have no problem to deploy the device. We were using it under dual antiplatelet therapy because as of now we have no recommendation to use it under single antiplatelet therapy, but it was a very nice device, and indeed we have to continue the evaluation of this new and innovative product. It is indeed very important to have a precise evaluation of the device. So as of now, we are preparing a single-arm study whose name is Coating, which is dedicated to the evaluation of safety and efficacy of the device. We will still use dual antiplatelet therapy because, as I was mentioning before, there is no recommendation to use it under single antiplatelet therapy, but it will give us a preliminary idea of the safety and efficacy of the device at short term and in mid-term, which means that we will have a 12 months follow-up in the study. There is a good friend of me who is calling, naming coating the holy grail of interventional neurology. Maybe it's too much, but I think it's effectively something very important because if we are able to treat ruptured aneurysm with flow diverter, with coated flow diverter, with surface modified flow diverters, it will clearly modify our global strategy of treatment for ruptured aneurysm. So it's very important in the development of interventional neurology in the field of aneurysm treatment.